Hi, I'm Lacey Nobles with the City of Lubbock. We'll get started in just a few seconds. Good morning, and thank you for joining us for the City of Lubbock COVID-19 News Conference. It's been a while since we've met, so today's panelists are Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, Chief Medical Officer for Covenant Health, Dr. Craig Ryan, and Lubbock Mayor Dan Pope. So we'll get started with Catherine Wells.
Thank you, Lacey. Today, I really want to focus on what's going on locally here in Lubbock. Over the past 2 weeks, we've seen the number of COVID cases, number of hospitalizations, and the number of people getting tested spike. It has increased significantly. This spike is similar to trends that we've seen across the country, but this is a local issue, and it is straining our healthcare workers, hospitals, EMS, the public health system, and our local laboratories. When this happens, we don't have people to take care of people that have other diseases and trauma and need emerging care. We are having so many people here that are sick with COVID, and we need to do things locally to slow that down. There are multiple contributing factors to the rise of cases, and the three main ones that are occurring here have to do with the Delta variant, low vaccination rates, and just that we're moving around more. So that Delta variant that you've heard on the news that we've talked about is here in Lubbock. We assume that 85% of our cases are associated with that Delta variant. And this variant is much more contagious than what we have seen in the past. Through our local follow-up with our cases and patients, we have seen 6 or 7 people get sick from just one exposure. Previously, with the other strains, it would only be 1 or 2 people getting sick from that one person. We have also now seen transmission between kids in camp and daycare centers. Previously, we'd see a sick child and we could link that exposure to either mom or dad or grandma. And now we're seeing that person to person or child to child transmission in our schools. Another contributing factor to our case counts are low vaccination rates. In Lubbock, we have 132,000 residents who are eligible for the vaccine who haven't started the vaccine series. With this large group of unvaccinated people, the virus is going to spread fast, and this is going to lead to more hospitalizations and, unfortunately, deaths. We're also moving around more and interacting with each other a lot more than we were doing at this time last year. With those interactions, many of us have stopped following those public health guidelines. Even our governor, in his last order, GA 38, states that individuals are encouraged to follow all of those safe practices that we have already mastered. To move forward, we need to take personal responsibility and follow those guidelines that our Texas leaders are telling us to do. We have enough vaccine in Lubbock to get everyone here vaccinated. We have multiple events over the next couple of weeks. The biggest one is this Saturday. We will be out with Covenant Health Systems at South Plains Mall. We will be offering the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine for free at the mall. This is also tax-free weekend, and the first 200 individuals that come to the mall will receive a $25 United voucher that can be used to buy school supplies, get those kids lunches as we get our kids ready for school. If you are a business and need your employees vaccinated, please contact the health department, and either ourselves or one of our community partners can come out and help with a vaccine clinic. If you have questions about the vaccine, please talk to your doctor or call one of our nurses here at the health department. And that health department number is 806-775-2933. And with that, I will pass it over to Dr. Cook.
Thank you, Catherine. Good morning, Lubbockites. Thank you for joining us. I want to talk to you about a couple of things. I want to talk to you about the science behind our recent changes in our recommendations about masking. And I'll talk to you briefly about some hospital data, but Dr. Craig Ryan will continue that conversation as well. So science is always changing. You know, we sort of get criticized because one day we say this and a few months later we say that, but we're trying to keep up with the current changes in the way the virus is acting. And so we want to make the best recommendations possible. Just a few months ago, we said our numbers were going down, our hospital numbers were going down. We had plenty of vaccine, people were getting vaccinated. So we said it's okay to spread out and to take off our masks and open back up. That was the right thing to do because we needed to help our economy and our community and get back to being with everybody and socializing appropriately. However, science also has shown us just recently that our COVID numbers are significantly increasing. I think everybody knows that. And so because we're seeing what's happening globally, nationally, and in our community, it has us concerned about this Delta variant. And I want to talk a little bit about the Delta variant, but it's because of these changes that we're seeing that it concerns us enough that we need to say it is best to mask, especially if you're going to be indoors in a very infectious community, a high incident community. And guess what? Lubbock fits that. We're in the red zone. So let's talk a little bit about the science of that, those things that pointed us to recommend masking. So first of all, we have been monitoring the number of cases and how much of it's been the Delta variant. And as Catherine said, about 80%, 83% is the Delta variant. This is a much more infectious variant. Now, early on, we said that the Alpha variant ran over or took over everything, but now it's the Delta variant. And the difference between the Alpha variant and the Delta variant is our vaccine is less effective, but very highly effective for the Delta variant. If it's the Alpha variant, it's 95% effective. So about 5% won't have a good take and can get sick, but most of those individuals won't get very sick. It prevents serious disease and or death. With the Delta variant, that number drops down to 87% or 88% effective. Now, that is still very, very effective. So that leaves us a window of about 12 or 13% that could potentially get infected, even though they've had the vaccine. So we have seen a number of outbreaks in different communities around the United States that shows that it is significantly more infectious. It's infectious as chickenpox. It's more infectious than smallpox and Ebola. If some of you remember the big Ebola scare we had a few years ago. That's number one, more infectious. Number two is that if you become infected with Delta and you're vaccinated, you can still spread the virus. Now, if you had the Alpha variant, we pretty much said, if you're infected or if you're vaccinated, you're safe, you can't spread it. However, the Delta is showing us different information. It says, even though you're vaccinated and you do have a breakthrough case, you can infect other people. And remember, the first one is much more effective. Now you can spread it to other people, even though you're vaccinated. Number three in this list here is it causes more serious disease. And you're more likely to be hospitalized, especially if you're not vaccinated. If you're vaccinated and you get Delta, you're not very likely to be hospitalized. We have a few cases, but very rare if you're vaccinated or you're hospitalized. If you are not vaccinated, there's a high likelihood that you could get sick enough to be admitted to the hospital. So that's number three. Number four is it lasts longer. The duration of the illness with the Alpha variant was about 13 days. With this variant, the Delta variant, it's about 18 days. Now that doesn't include the long recovery that many patients have after being infected with any kind of COVID. So from 13 days to 18 days. So it was those things that we saw. So the Delta variant is highly contagious. It causes more severe disease and much more likely to be hospitalized. It lasts longer. and it affects a much younger age group. Those are the things that concerned us as scientists, as healthcare providers, that says, wow, you should put on a mask now, even if you're vaccinated, and especially so if you are inside a building where there is lots of people around you. It is our recommendation that you get vaccinated, and that you mask up. Let me reiterate that this vaccine is very effective. 95% or 88% against Delta, 95% against the previous strains. It is very safe. The American College of Obstetrics and Gynecology and Society of Maternal Fetal Medicine, two professional physician groups that says it is safe for pregnant women and women to receive this vaccine. Many other professional groups have signed on: American Academy of Family Physicians, the American Academy of Pediatrics, the American Chest Physicians. So, and some 50 odd other individuals, groups, professional healthcare groups have signed on and said, please get vaccinated. This is a safe vaccine. We must stop this virus. So get vaccinated and put on your mask. Now, the second thing I wanted to talk to you about just briefly is some hospital data. Our average age in this Delta variant, currently in this spike, is very much younger than the previous group that was infected. Typically, those people were much older. Now, the average age between the 100+ patients that are currently hospitalized in Lubbock, the average age is just around 50 years old. That's pretty young. We are seeing young individuals and adolescents, a few adolescents. We're also seeing 20-year-olds, 30-year-olds, 40-year-olds that are being hospitalized. We hadn't seen that before with the Alpha variant, but now we're seeing it with the Delta variant. And 95% of those that are hospitalized have not been vaccinated. We are seeing a rare occasional breakthrough case. In other words, you've been vaccinated, that are sick enough to come to the hospital, but very, very rare, very rare. Please know that we have adequate supplies in the hospital. We are running out of room in the ICUs in our hospitals for COVID patients, and our staff are tired and they're stretched very thin. They've been through this before. We know how to take care of you. We're just tired. But please know, we will take care of you if you become ill. However, it is our belief that your best option is to stay out of the hospital by getting a vaccine and wearing a mask. That's all that I have. Let me hand this off to Dr. Craig Ryan. He's the Chief Medical Officer for Covenant Medical Systems. Dr. Ryan.
Thank you, Ron. And I want to just echo the sentiments both from Catherine Wells and Ron Cook, that this is a different phase of this disease process. We are seeing a much younger population be affected by this. And the most eloquent statement that I have seen lately came from one of the CMOs from one of my sister hospitals. And he actually said that the unvaccinated amongst us are holding the rest of us hostage. And what he means by that, it's not a challenge. It's not a condemnation. It's the effect that we will not get past this until the majority of our citizenry are vaccinated. So it's becoming a civic duty to be vaccinated. It is affecting a younger population. And just like Ron said, we have both emotional and physical fatigue with our caregivers. Our nurses, our doctors are absolutely worn out. We've been going through this with you for the last year and a half, and they're exhausted. They're to the point now that they're emotionally labile. They don't know how much more of this they can continue to deal with, because it's just coming back because people are unvaccinated. We are getting requests here in Lubbock for transfers from all over the state of Texas again. And we simply don't have the hospital capacity to bring people here from Houston and the Rio Grande Valley and Laredo again, because we don't have the staff of state-supported nurses and state-supported doctors that came in to help us with the last peak. So we're on our own this time. And it really is a civic responsibility for everybody in West Texas to get vaccinated and stop the spread of this awful disease before it becomes an absolutely critical crisis here on the South Plains. We see a lot of people that are vaccine hesitant. And one of the things that we see most often is people say, well, I'm young, I'm healthy, I don't need the vaccine. If I get sick, it won't bother me that bad. Well, you just heard from Ron Cook, that's not true anymore. The Delta variant is affecting younger people. We're seeing a much younger population admitted to the hospital that refused to get a vaccine, and they are desperately ill. The other reason that some people are saying, I don't want the vaccine, is it's not fully FDA approved. Well, it is approved under emergency use authorization, and I would change the discussion to ask you this. If you were drowning and I threw you a life preserver, would you check the label to see if it's Coast Guard approved before you decided to use it? That's where we are. We are all drowning in COVID-19 cases. The Delta variant is going to overcome us if we don't stop some of these arguments about why I don't want to personally get the vaccine. Everybody's fatigued. Everybody's tired. As Ron said, we're going to do our dead level best to take care of everybody that we can take care of, but recognize that there are limitations to the healthcare resources on the South Plains. And unlike last time, we don't have the state cavalry coming over the hill to rescue us. We're on our own, and we have to deal with the resources that we have left here in Lubbock to deal with this resurgent pandemic. So that's what I wanted to share with the group today, and I'll turn this over to Mayor Pope.
Thank you, Dr. Ryan. Good morning, everyone. I want to start with some data slides. Bear with me for one moment here. I haven't done this in a while. Okay, let's start from the top. So you see that this is a slide that is familiar to you. It's our hospitalization rate. The orange line is there for reference. The governor's order no longer has a trigger at 15%. However, it is a threshold that really shows where it becomes very difficult on our hospitals, as Dr. Ryan just spoke to. This is the data around the age distribution of new cases over the last 14 days. I think it really bolsters that point about younger people being more affected by this Delta variant. We're up to about 1,500 active cases in the county, which means that the virus there's general prevalence. It's frankly, it's everywhere. Bit of good news here. This is vaccines administered by week over the last 5 weeks. You can see that the last 2 weeks, we've about doubled what had been our going rate. That's very good news. We'll talk more about that in a moment. And finally, another vaccination slide. This is it's in your face. I mean, first of all, 12-year-olds and under are not eligible. It's about 17% of our population. That means that taking those out, about half our population is vaccinated, half is not. Now, there's good news in here. Our 65 and above, about 73% are fully vaccinated. However, there's a lot of young people, 12 to 65, and certainly in that middle range of that 18 to 40 that are not vaccinated. And it's critical that they consider and that they get vaccinated. That really it's more than just considering it. I want to start by expressing my empathy. I learned really just before I got on this call of the death of a father of a friend of mine due to COVID. I was in a small business this morning who it's hard enough to be in retail, but to be in retail during the pandemic, just getting to sort of see it in their eyes and talk to them about it reminds me of the impact it continues to make in our community. I'm thankful for Catherine Wells and her team. I'm thankful for Dr. Cook and Dr. Ryan and all the physicians and nurses and caregivers that they represent in our community. We really look at you as our heroes. I read an article over the weekend in the Wall Street Journal. It was actually a column, and I want to read the opening to you because I think it sort of sums up the messaging that I wish was coming from the feds. And I think it's important for you to hear it from me. As the coronavirus evolves, so does science. You heard Ron say that a minute ago. As the coronavirus evolves, so does science. The Delta variant is creating uncertainty about how much vaccines prevent transmission. But the overwhelming evidence shows they are highly protective against severe illness. Please get vaccinated if you aren't already. Last week, there were some 35,000 symptomatic folks who had already been vaccinated. Now that's 35,000 of 162 million fully vaccinated Americans. That's 0.002%. You have a much greater chance of being in a severe car accident. Recent studies confirm vaccinations are still 88% protective against symptomatic illness and 96% against hospitalizations and death. Earlier this week on Monday, when we looked at our numbers, there were no vaccinated patients among those in our ICUs in Lubbock. Zero. You know, this virus is never going to be eradicated. It will become endemic. But our public health goal is to try to keep people from getting ill and keeping them out of the hospital and saving lives. The vaccine is free and it's widely available. Please get your vaccine. One final comment. There will not be a mask mandate coming from the city. The governor's order makes that very clear. However, the governor's order also, nearly in the same breath, says, take every precaution, cover your face, keep your distance, wash your hands. The governor was one of the first people to line up to get vaccinated in January or in December. We completely respect businesses, churches, folks that are holding events that choose to ask people to wear masks. That's the right you have. There will not be a citywide mandate. We understand how to slow the spread. It's up to us. This is a task that's accomplishable. Thanks for your time. Lacey, I'll send it to you.
Thank you, sir. We can have our panelists turn on their microphones and their cameras. We will open it up for media questions. And today's media question order will be Texas Tech Public Media, the Daily Toreador, Latino Lubbock, KMAC, KLBK, El Editor, KCBD, and the Lubbock Avalanche Journal. So we start today with Jamie Lozano with Texas Tech Public Media.
Hey, can y'all hear me okay?
Kim.
Perfect. So first I wanted to ask y'all, how often are we testing for the Delta variant, and is testing for it only under certain circumstances?
Ms. Wells, would you answer that, please?
Yes. So it's a two-step process to identify if something is the Delta variant. First is the test that's either conducted at the health department, your doctor's office, or the hospital, and that tells you whether or not you're COVID positive. A selection or a sample of those tests is then sent to an additional laboratory to determine whether or not it's the Delta variant. And there's about a 2-week delay between somebody being COVID positive and us knowing it's the Delta variant. We're seeing more and more Delta variant here in the community. So we know that what's driving this is the Delta variant.
Thanks, Catherine. And then my last question would be, given the new wave, will the city be changing how it reports COVID data?
Catherine, you want to handle that one too?
Yeah, we update our COVID dashboard every day between 4 and 5 on Monday through Friday. And I believe we'll just continue with that same reporting.
Awesome. Thank you all.
Thank you, Jamie. Now move to Mateo Rosales with the Daily Toreador.
Good morning. My first question is, will the health department set up any vaccine clinics on or around the Texas Tech campus to help the student health services here on campus?
Yes, that's a great question. Let me start on this, and Catherine, you can help me. Through our partners at TDM and with support from a mobile vaccine clinic from the health department, we will be supporting tech dorm move-in and new student registration will be there it's a spread out process this year, and we will be part of that. I talked to Lubbock Christian this morning. I think they're going to engage us to do something similar there. We're doing the same thing in all our school districts in different ways for each one, but we're very active trying to provide vaccine availability for our students and their families. Catherine, you want to build on that?
You summed that up nicely, Mayor, but I will add that, if you're a student from Dallas or Austin, it doesn't matter where you reside, you can still come get your vaccine here in Lubbock. So there's no residency check. So if you're a student, you're here in Lubbock, please come get your vaccine from any of our pharmacies or any of the health department clinics.
Perfect. And then my second question, Dr. Cook, you talked about how the Delta lasts longer, around 18 days. Does that mean that if you do contract the Delta strain, you have to quarantine for longer?
No, we've not changed the quarantine requirements right now. So it's still 7 to 10 days or so. But if you're positive, please check with us so we can help you determine what the appropriate time is. That's not changed yet.
Thank you.
Thank you, Mateo. Now we move to Christy Martinez Garcia with Latino Lubbock.
Good morning. It's good to see you all, unfortunately, in this circumstance. But my question is for Dr. Cook and Dr. Ryan. And I just want to say before I ask my question, Catherine, the health department has done a wonderful job in all its proactive efforts. But I disagree with you in not getting that information out in the way that it was being sent out on numbers. The Delta variant is currently the most prominent strain of COVID-19, but the Lambda variant out of South America is also emerging. Dr. Cook and Dr. Ryan, how are we preparing for this next variant, which I hear is even more contagious?
Well, the best, so there's two ways to stop spread of this disease, right? One is mitigation factors. Those mitigation factors include masking, social distancing, washing your hands. The other one to stop the disease is actually getting the vaccination. I've heard about the Lambda, but they're currently in testing right now to see how well the current vaccines respond to that variant. Here's the thing, Christy. If we stop the replication of the virus, and the way we stop replication of the virus is by vaccination. If we stop the replication, it cannot mutate. So if we stop the replication by vaccination, we can stop worrying about these mutations.
Okay, let me go ahead and go on to the mayor. Mayor, as you know, public health must be above politics, and making sure the public has details and understanding is imperative. And considering that we have the playbook from the first time we were dealing with this, do you believe that you've been proactive and not reactive? I mean, it took us all these weeks to get to here to press conference to address the growing numbers. Shouldn't we have been proactive instead of reactive?
Well, I think we've been proactive. I think, I'm not sure that holding a press conference measures whether we're proactive or not. We've remained vigilant. We have a regular cadence of our public health meetings. We talk about this on a daily basis. We talk with our stakeholders around the community. We've continued to try to take vaccines everywhere people are gathered, and to provide education and to awareness around the vaccine and what keeps people safe. I do believe that you'll see us more, Christy. In the next few weeks, we think that we likely can get more of people's attention as school starts and people return to a routine. But it's important that we all work together. And Christy, you've been very helpful, and our other media partners on the phone or on the call have been too. We need to continue to share the science with our citizens and give them the opportunity to make a decision to get the vaccine, which is available, it's effective, it's safe, and it's free. Thanks, Christy.
Thank you.
Thank you, Christy. Now move to Katie Gray with KMAC News.
Hello, can you hear me?
Yes.
Yes. Okay, excellent. Thank you so much. So actually, my question is a little bit geared towards the mayor, especially with us going into the fall and over the next couple of weeks. Aside from getting vaccinated, while I know that that is the number one recommendation, should we expect any other suggestions or mandates for the city to put into place?
No. I mean, nothing's changed, Katie. We know how to stop the spread. There are not going to be mandates. And I think I mentioned that in my comments earlier, but I get a chance to reinforce that.
Okay, excellent. Thank you. Okay, so especially with, so then another part of my question is that Lubbock and the area have one of the lowest fully vaccinated rates in the state. It's certainly not from an effort of efforts. Why do you think that that is?
I can't answer that question. I'm not. Maybe let's just say it's rugged individualism, sort of that West Texas spirit. I'll go with that. I'm gonna let Dr. Cook and Dr. Ryan answer that. They've been at it a long time and doing what they do in this part of the world. Both native West Texans. Craig, you go first.
Let me answer that by saying I've heard every excuse in the book for not getting the vaccine, and I addressed some of those with my earlier comments. Most of the people that I've seen that were reluctant to get the vaccine said, well, I'm younger, I'm healthy, it's not going to affect me. Well, that's no longer true. The second was what I said before, that, it's not gotten full FDA approval, even though we have emergency use authorization for it. And that's just an excuse that just doesn't hold water anymore, because it is known, as the mayor said, to stop the spread of this disease, to stop the severity of this disease, even if there are breakthrough cases, and to keep you out of the ICU and out of the morgue. So there's really no excuse for not getting the vaccine anymore, other than just, as the mayor said, rugged individualism. But we need to stop some of the rugged individualism and start thinking about the welfare of our community, because the healthcare resources of this community are literally becoming overwhelmed. And people need to realize that we're turning away cases that we shouldn't have never been able to turn away before, simply because we don't have enough nurses, enough hospital beds, and enough doctors to take care of what we're being asked to take care of. So the vaccines are critically important. It is almost our civic duty at this point to proceed with getting the population vaccinated.
I really don't have much to add to that, Katie, other than I know there was some hesitancy early on amongst our women in our community, and fertility issues and pregnancy issues and pediatric issues. I know it's not available for all pediatric age groups. I think we'll see that come soon. However, the American College of Obstetrics and Gynecology, the American Medical, or the Association of Maternal Fetal Medicine, and the American Academy of Family Physicians, American Academy of Pediatrics, all have strongly recommended this drug to those patient populations as extremely safe and extremely effective. So, in many drug studies, they do 8 to 10 million doses to see what the side effects, et cetera, are. We now have given close to 350 million doses of this drug with little or very few side effects. It's a safe drug and very, very effective.
Now,
One other answer that I would want to add to what Dr. Cook just said was, we see a lot of spectacular press about the complications of the vaccines. And one of the ones that got the most press recently was incidences of myocarditis or pericarditis, inflammation of the heart following the vaccine administration, especially in younger males. The truth is that about 5 out of every 100,000 males got some degree of mild inflammation of their heart muscle after the vaccine. But the other absolute truth is 1 out of every 43 patients that gets COVID-19 gets that same inflammation. So if I were going to play the odds, I'll take 5 out of 100,000 versus 1 out of 43 any day of the week.
now we move to Skylar Soto with KLBK. Can you unmute, Skylar?
Can you hear me?
Yes.
Okay. At what point where measures are put back into place in Lubbock?
I'm sorry, ask that question again.
Skylar, you're cutting out. We didn't hear your question.
At what point, or is there a certain point where measures are going to be put back into place here in Lubbock?
Skylar, you're cutting out. So could you type me your question and I'll ask it for you? And we'll move on to Olga Aguero with El Editor in the meantime.
Buenas tardes. Hello, everybody. Good to see you back. I've got a couple of questions, but I guess it's fair to say, Mayor, and I guess the physicians, that Lubbock will not be like taken for granted as forever inputting or enforcing, but let us get to as close as we can to encourage everyone to start wearing masks and to maybe recommend or push these businesses or the teachers or the medical professions to get vaccinated and to live by example. And, you know, if we live by example and show others what we're trying to emphasize and push, I think the success will be good. So, you know, I wear a mask and and regardless if I'm just going in and out from a grocery store, I think it's important, it's demanded right now, and it's our civic duty, like the physician said earlier. And I think just by living by example as a civic duty, we will, and we ask everyone to get vaccinated and start with family networking first, and then friends, and then it goes on and goes on, and encourage our people in the church, in the ministries and everything to push the vaccine, so we won't go back, and just really emphasize that. I think that is what is really meant and was asked previously, Mayor, for you. But one of the questions is, now that we have patients in there, and most of them y'all are saying, doctors, that they're unvaccinated people, are any of these people saying the importance of getting vaccinated to the public, as of now?
Christy, are you talking about individuals, patients that had COVID and?
Or that, no, they didn't get vaccinated at all.
Oh,
And they're in the hospital, and hopefully with God's grace, they'll get out, but while they're in there, are any of them saying, or to say how important it is to get vaccinated and to get that word out?
yes, there's, I think most have thought that it would have been easier to get a vaccine, but I can't speak for them. I've not talked to them personally, but I hear anecdotal responses from the people that are taking care of them that get back to me and say, sure, we should have received the vaccine.
Okay.
Never met anybody
Dr. Ryan can relate a good story on this, Craig.
Now, I haven't met anybody yet that's in the ICU, on the ventilator, or even on the hospital floor that was unvaccinated that said, I'm glad I didn't get that vaccine. They get religion real quick when their life is threatened by this pandemic, and they really don't, they're like non-smokers or reformed smokers. They are the biggest advocates that we have regarding vaccination. The other thing I'd like to add to this discussion is, early on in the pandemic, our Hispanic population had the exact same incidence of disease that every other racial group had, but they were more adversely affected by it. In other words, there was more morbidity and mortality in our Hispanic population, even though the incidence of cases was the same. I'm scared to death that that's going to repeat itself. And for reasons unbeknownst to me, our Hispanic population is one of the more resistant to getting the vaccine. We've got to get that message out. This is really hurting them more than everybody else. But as you asked, everybody that's gotten COVID-19 and has required hospitalization has regretted their decision to not get the vaccine.
Thank you. Last question is, all medical procedures being scheduled or were delayed at one time or postponed at one time, will that be going on right now, or y'all don't foresee that?
Dr. Ryan, can you address that?
I can. At this point in time, the governor's executive order that required us to postpone elective procedures and elective admissions once the Regional Advisory Council's census reached 15% or more of hospitalized patients is no longer in effect. So we're not under gubernatorial mandate to do that. But the truth is, we may not have enough hospital beds, doctors, and nurses to do anything else. So we may actually be forced, by virtue of just the sheer resurgent numbers, to curtail some elective services. We haven't reached that point yet, but we're probably not too far away from it.
Olga, thanks for all you do. You've done a nice job. Keep advocating for this, okay?
Thank you very much. God bless all of y'all.
Olga, I apologize. I may have called you Christy. I apologize for that.
That's all right, Doc.
Thank you. Now I move to Case Wilbanks with KCBD.
Good afternoon. I have a question about hospital preparedness. Dr. Ryan, you said hospitals are on their own, but are you collaborating between each other, maybe in Lubbock or regionally, to maybe address some issues in the future with workforce or with supplies and things that might not be coming from the state?
We are reaching out in every direction to try to get more healthcare workers, more nurses. We've got a request to the state, a STAR request for nursing assistants, because honestly, we've had a lot of nurses that have retired. We've had a lot of nurses that have been out on disease-related furlough. They've gotten COVID and they're home recuperating. Our nurses are wonderful. They are doing everything in their power to do as much as they can possibly do, but there are just simply limitations to what they can do. Whether or not we get support from the state again is probably not going to happen, but we've made the request just in case there is an opportunity there.
Thank you. And Catherine, you mentioned the issue that you're seeing with daycares, with child-to-child transmission. Of course, school is coming up, and we know there won't be any sort of mandates coming, but what is your advice to school administrators dealing with this, to daycare owners, administrators, to deal with what you see as an issue right now with that child-to-child transmission?
Well, with daycare administrators that are in operating right now, we've been in constant contact with them. And I really advise them to talk to the health department. If they have a case, I really advise them to work with their staff to get them vaccinated, and really encourage any of those unvaccinated daycare workers to, wear a mask to prevent the spread. We will be in constant communication with our school districts as we move towards the opening of school, and we are all, very closely following all of this new data.
Case, I want to just make sure you realize that the state is still involved in what we're doing. You heard me mention TDM and the vaccination clinics. They're still running through a contractor running the infusion clinic in Lubbock, which is fully subscribed. We've asked them actually to expand upon that. We have the hospitals have the ability to use FEMA dollars to hire nurses if we can find them. And that's actually 100% reimbursement. There's not a match as there often is with FEMA dollars. So we remain in communication with the hospitals as the hospitals do with each other. None of that's changed. It's just, I don't expect that we will have an army of visiting nurses coming back to our community.
Thank you.
Thank you, Case. Now move on to Gabriel Monty with the Lubbock Avalanche Journal.
Good afternoon, everybody. Can you all hear me?
Yes.
Yes.
Great. So my question is, as mentioned earlier, we have 132,000 eligible people who haven't been vaccinated. Was that about the right number?
We have approximately 132,000 individuals that are not vaccinated that are eligible for the vaccine.
Right. So I know the goal is to have everybody vaccinated, but is there a threshold where we'll see some relief? Like what percentage, I guess, are we looking at to see some relief from the surge that we're experiencing right now?
Well, if you're talking about, Gabriel, if you're talking about herd immunity,
yes,
it sort of depends on the virus, and because this one's more infectious, that means our percentage of vaccinated needs to be even higher. So originally we were thinking around 70%, and so I would say 80% or more for it to really not propagate.
130,000?
Yes.
Okay.
Of the entire community. So.
Gotcha.
But I want to add that every time we vaccinate another person in this community, it helps.
Yes.
It's not a just on or off switch, herd immunity or no herd immunity. The more people can get vaccinated, the better. And it's going to slow down this spread.
And my second question is just, you were talking about our frontline healthcare workers being overwhelmed. Are you concerned that there's a tipping point where people will just quit? Is that something that you're concerned about here in Lubbock?
Well,
Go ahead, Ron.
we are dedicated, healthcare providers are very dedicated, very, very dedicated, just like most individuals are to their own job. They do experience both physical fatigue and mental fatigue. And when you're working this hard, we worry about medical mistakes. And so I can't answer that one wholeheartedly, but certainly common sense would tell you that the harder we work, the more tired you're going to get without a break. And so, Dr. Ryan.
Well, I would add that we had a nursing shortage and a physician shortage before the pandemic ever hit. And this certainly hasn't done us any favors. We are still challenged with keeping enough nurses to adequately care for our patients. We are doing a good job at that. They're doing an unbelievable job of stepping up to the challenge, but there is a limitation to the number of nurses that we can have here on the South Plains, and they are already pretty much maxed out with the workload that we can ask them to accomplish. So Ron is right. We may be reaching a tipping point, and if we don't get more people vaccinated, it may overwhelm the system.
Those are all the questions I had. Thank you very much.
Thanks, Gabriel.
Thank you. This concludes our news conference. Thank you for joining us. Thank you to our panelists and our interpreter. And remember, for the latest, most accurate news from the city, follow the official City of Lubbock social media accounts. And until we see you next time, be safe.